How to use Femina Compact Applicator Tampons. Wash your hands thoroughly before you open the tampon wrapper. Tear half of the wrapper and uncover the tampon applicator. Ensure that the tampon cord hangs down through the end of the applicator tubing. Gently squeeze the front part of the applicator with your thumb and index finger while turning and pulling the inner applicator tube backwards. Ensure that both tubes rotate freely and the tampon is in front of the expanded applicator and that it does not move along with the inner tube. Remember, if you do not pull the inner tube out freely behind the tampon base, the tampon will not eject properly out of the applicator. Locate your vaginal opening. It sits 2 to 4 centimeters below your urethra, where urine exits, and it is the opening for your menstrual blood to flow out and where the tampon will be inserted into. Relax the vaginal muscles and get into a comfortable position. You can either sit on the toilet with your knees apart, stand in a squatting position, or stand with one foot on the toilet seat or the edge of the bathtub. Hold the applicator at the end of the outer tube. Position the rounded end of the applicator at your vaginal opening and point it at an angle towards your lower back. With your free hand, gently open the folds of the skin around the vagina. Gently insert the applicator into your vagina until your fingers touch your body. It is important that you insert the outer tube all the way to this point so that the tampon will eventually be positioned high enough into your vagina. Still holding the outer tube at its base, use your index finger or the other hand to push the inner tube firmly into the outer tube until the two raised rings meet. This pushes the tampon out of the applicator and into the correct position inside your vagina. Slowly remove both tubes of the applicator, leaving the cord hanging outside your body for easy removal of the tampon later. You should not be able to feel the tampon inside you. Wrap the applicator in toilet paper before disposing it along with the wrapper into a covered waste bin. Do not flush them down the toilet. If you can feel the tampon, then it may not be inserted far enough. Insert your index finger into your vagina until you can feel the base of the tampon. Push the tampon up as far as you can, taking care to leave the cord hanging outside the body. To remove your tampon, firstly, wash your hands. Relax your vaginal muscles as much as you can, and slowly but firmly pull the removal cord until the tampon slides out. If the tampon seems tight, wait and give the tampon more time to saturate before you pull on the cord again. Remember, the tenser you are, the harder the tampon will be to remove. If the tampon is still dry and tight to remove after 8 hours, then we advise that you switch to a lower absorbency tampon. You can either flush the tampon away or, as recommended, wrap it in toilet paper and dispose it in a covered waste bin before washing your hands again. Remember, it is impossible to lose your tampon as it can't go anywhere. If you lose the cord, squat down, push your vaginal muscles downward, and you should be able to reach inside and feel the end of the tampon or the cord and pull the tampon out. If you cannot feel the tampon or are unable to remove it yourself, your doctor will quickly and easily be able to do it for you.